Ladies and gentlemen, welcome to the stream. You are now tuned into Mass Consciousness, and tonight we have an amazing program for you. I'm your host, June Archer. You might have seen me on a couple of shows, but tonight we are talking about the Plannedem-MIC. You're in for a treat with some great performances, world premiere of the video, and right now we're going to get this thing started on the right foot. We are now getting ready to bless this stream and this evening with an amazing performance. I would like you all to please welcome to the stream Professor Gregor Hubner. And he's going to be doing an amazing performance. Gregor, take it away. Ladies and gentlemen, that was Professor Gregor Hubner. Thank you so much. You all sound amazing, and I know that we have some more performances from you. So if you're at home, wherever you're watching, please just clap your hands to show some grace for these amazing musicians. Thank you so much. And now we'd like to take our attention to have our mission statement. And this mission statement is going to be read by none other than Gregory Kirschenbaum, LMT, and he is a humanist. So, Gregory, how are you doing today?
Thank you, June. I'm grateful to be here. Thank you for having me.
I appreciate you, and I know that you have something to share with us, and so I'm going to let you take it away. Thank you so much.
Thank you, sir. Mass Consciousness, MK. Our purpose is to awaken the collective soul of humanity, educate society, bringing awareness to their sovereignty and inalienable rights, which are already encoded in our spiritual body. Using the spoken word, music, activism, and integrative systems of healing, every person can be fulfilled and outfitted to feel empowered, understanding that no one, no corporation, no private nor commercial entity owns your body, mind, intelligence, or soul. MK, mass consciousness, is the only way to fight diabolical, nefarious, negative forces and negative entities by using emanating positive light, collective prayer, voting power, political activism, and spiritual unity. Condemning, shutting down agencies knowingly committed to human demise. We, the people, human beings of planet Earth, must hold negative forces accountable by speaking out, protecting vulnerable communities, Mother Earth, the environment, our human microbiome, and future generations. We, the people, must stay vigilant, working together to save ourselves against corrupt agendas, policies, and agencies committed to eugenics and depopulation. Using ill will techniques, genetic warfare to manipulate, alter, disrupt, and deconstruct thousands of years of nature, immunity, and human biology. This is simply wrong, morally and ethically. Do not comply to those who mean you harm. Now is the time to organize against agencies, never allowing fear, confusion, distraction, polarization, and misinformation to control our destiny. We, the people, e pluribus unum, global citizens of planet Earth, it is up to us to preserve life, live in joy and love, incorporating the pursuit of happiness, protecting democracy, freedom, and liberty. We are light beings, ordained with immutable, infinite power and resources. Our future is now. Tomorrow is today. Conscious activism begins with billions of you. Get off the sidelines. Are you ready to do your part? Remember, your civil rights, human rights, inalienable rights are innately yours. Right now, so much is at stake. The world is under and going through forced negative evolutionary metamorphosis. Be the change you want to see. Ask not what your country can do for you. Ask what you can do for your country. John F. Kennedy, 35th President of these United States of America, January 20th, 1961.
Gregory Kirschenbaum, thank you so much for that. Very powerful, very spiritual. We appreciate you. Thank you so much for blessing us with that.
Thank you, Jim. Thank you so much for blessing us with your presence today and all that you're doing for us, all of the world. Thank you so much.
I appreciate you. Ladies and gentlemen, we have another amazing performance coming up. And right now, she needs no introduction. She goes by the name of Donna Mandarano. And I can tell you, during rehearsal, it was amazing. Please welcome this live performance. It's Time for Healing, featuring Donna Mandarano, Gregor Hubner, Feng Chernwei, Ron Lawrence, and Jeremy Harmon. Ladies and gentlemen, Donna Monderano.
Yeah, good.
COVID-19 is the enemy, an invisible enemy we cannot see. Don't let viruses stop you from living free. Together we can break the chains of negativity. People all over the world are suffering from COVID-19. Don't you agree? Don't you agree? It's time for healing. It's time for healing. It's time for healing. It's time to rise. People everywhere across the land and sea, stand strong, don't give up. Please open up your hearts, give what you can, together as one. With the trust from above, we can overcome. If we put our faith in love, it's time for healing. It's time for healing. It's time for healing. It's time to rise. So please remember, we are all children from the Most High. Together there's no mountain we cannot climb. It's up to you and I. Time to rise, time for God's light to shine. It's up to you and I. It's time for healing. It's time for healing. It's time for healing. It's time to It's time for healing. It's time for healing. It's time for healing. It's time to rise.
Amazing, amazing, Donna. Thank you so much. That was wonderful. I don't know the inspiration behind that, but I know that it was heartfelt. Thank you, gentlemen, for the amazing performance. That was amazing. That was really, 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 really amazing. Thank you so much, everyone. Right now, I'd like to bring in our global citizen letter by Brother Stephen Hill. Ladies and gentlemen, please welcome Stephen Hill to the stream. Steve, how you doing today?
I'm doing pretty good. How you guys doing?
We're having a great time. We started off with an amazing prayer, 2 amazing performances, some inspirational words, and now you're up next, and we're just excited to see what you have to add to the stream to bless us and continue to inspire and motivate us. So, Brother Stephen Hill, take it away.
Well, I have I always appreciate a good prayer. I've appreciated the words and the performances. And, when Dr. Ford reached out to me for this, I jumped at the opportunity because he has been a mentor, a friend, a confidant, someone I could always turn to. So when he turned to me for something, which the man doesn't need anything, so the fact that he asked me to do something, I jumped at the chance, and I am honored to read this letter.
Well, thank you so much.
All right. Open letter to global citizens. Dear global citizens and fellow countrymen, we the people, global citizens of the world, citizens of planet Earth. We the living must defeat this cunning, aggressive virus. This virus born from the devil travels anywhere unescorted, without permission, with a salacious appetite, leeching and sucking out life from human beings' inner ecosystem. Make no mistake, we are living in perilous, challenging times. This evil virus knows no distinction about nationality, race, ethnicity, color, religion, economic status, borders, and boundaries. It ravages the disadvantaged, the well-to-do, the young, the old, and the healthy. If we are going to come out of this successfully, integrated and whole, we the people must set aside our differences, set aside singular thought and personal grievances, act, concentrate as one efficient, positive mind, asking ourselves what we can do to end this ravaging crisis. We the people, global citizens of planet Earth, must band together in solidarity, preserving our legacy and healing humanity. Now is not the time to panic, to act a fool, to retreat, give up, or withdraw into yourself. Now is the time to be centered and focused, to check on your neighbors, the less fortunate and least among us. Now is the time to demonstrate profound kindness, empathy, and godly love. Now is not the time for pessimism, paranoia, or negative thoughts or negative actions. Mankind has a secret weapon to defeat this virus. This potent weapon is known as the Trinity: God, love, and spirituality. If we come together as one in holy matrimony, praying at a high vibration, this positive molecules that holds up, sustains, and supports gravity can render this evil virus helpless. Make no mistake, humanity. Civilization as we know it is under siege. I'm calling on the unifying body of positive actions-oriented persons. I'm calling on the best medical, technological, business, and scientific minds, pooling information and resources in fighting and addressing this horrible and invisible enemy. Remember, this virus is cunning, appalling, repulsive, horrendous, despicable, hideous, horrid, unbearable, and shocking to we the people. This virus is definitively airborne. It is an equal opportunity virus. It never rests, it never sleeps, it mutates, shapeshifts as we speak, live, and breathe. Tomorrow is now. Together we can overcome if we act as one. Together we can get things done. We the people, the global citizens of planet Earth. Thank you.
Thank you, Brother Stephen Hill. We appreciate you. Amazing words, very inspirational. And like you said, you jumped at the opportunity, as did so many others tonight. And we appreciate it. We thank you. We love you. Thank you, brother.
Love you.
Ladies and gentlemen, that was Stephen Hill. And some amazing words, from that Global Citizen letter. I want you guys to take note that the songs that you hear this evening will be available via the website. We'll be sharing that information momentarily. Tuesday, you'll be able to go on to the website, Mass Consciousness, and purchase these songs to support the movement. So please make note of that. We'll be sending the links out. You'll be seeing the links throughout this stream. Please support as best as you can. Right now, we'd like to bring in another speaker, interventionist and sobriety coach. Please welcome to the stream, Kevin Sullivan. Kevin, how you doing today?
June, how are you, brother?
Oh, I'm great. I'm having such a great time this evening. I'm inspired even more than I was when I got on the stream to learn about what we were doing this evening to give consciousness and figure out what it is that we're doing while we're in this situation and how we could potentially get out of it, not just from a local standpoint, for a global standpoint. So, ladies and gentlemen, Kevin Sullivan.
Yeah, man. Good to meet you, buddy. I'm giving you a big hug from down here in Miami Beach, buddy. You know, Dr. Ford also asked me to come in. He's been my dear friend and brother and family to me for almost 30 years. And when he asked me to come in, I said, well, what do you want me to talk about? He said, well, we're talking about COVID here. And one of the projects that we started working on in the middle of COVID, June, was, what's going on with people that are in the street that aren't fortunate enough to have a roof over their head. And as things started to shut down, the parks that many of these folks would sleep in were closed. And so they had nowhere to sleep. And where they would go shower would be at the beach, where they had showers. The beaches were closed. And then I'm thinking, where are they going to eat? Because all the restaurants where everybody would go get food, everything's done. And then I got hit with COVID. I thought, well, I can't just lay here. Let me just see if we can activate some people. I had friends in the restaurant business and people coming by the house. We opened up the back of the house and opened the gate and put the hose out there so people could get showers and really tried to involve the community in that way. And I just saw, one of the beauties was I saw how the community came together. I said, I'm sitting in the house. Let me go sit on the porch. So even though I can't hug you, we can be together even from a distance. So there were just so many things that popped up and so I'm just honored to be here and to speak about those things. But even broader than that, I watched people go into isolation that had never been in those spaces before, and the phone started to ring, and people would talk about, well, I'm depressed and I'm drinking more than I normally would be, and the children with screen addiction and other things that would just start tearing at the family's attention, and all these things would come up. And I just feel so blessed to be here, a part of this community tonight, be here with my friend Jannard and Dr. Ford and my friend Satya and Bill Sofke and my friend Eric and all of you. I just am in deep gratitude. I think what comes down to me is, if you have it in you, you gotta do it. You gotta help. You gotta go down in there and get what you need to be useful. And even though I may not feel like I'm up to the challenge, I can call on others that are, maybe a little bit stronger to come in and help and be there to give the folks a hug that need them, and to be there to have the conversations when somebody's a little bit down, because this group of people and many folks that are just feeling lost, they just need a good ear, to listen to the wound. I mean, the blessing lives in there, so thank you, my friend, for having me. And I'm just, as I say, I'm just honored to be here and sit with the rest of you. And the music is just as big a medicine as any voice that would be heard tonight. So I'm grateful for the music.
Thank you so much, Brother Kevin. I know the doc appreciates it. I appreciate it. I love the kind words. And wherever you are, wherever you're sitting this evening, we're sending you love. We're sending you light, inspiration, and we have our arms around you this evening. So thank you so much.
Yeah, we just keep blessing each other, don't we?
Yes, we have to. During these times, the good book says, and this too shall pass.
That's right.
But we have to lift one another up while we're doing it. So we appreciate you. We thank you. Thank you so much, Brother Kevin Sullivan.
Yeah. What an honor, man. Thank you, my friend.
Yes, sir. Ladies and gentlemen, that was Kevin Sullivan. If you heard his words, they were heartfelt, and we love what he's doing. We'll keep the program going. Right now, coming to the stream, we have Dr. Tawana Guilford. She's a licensed psychologist, and she has a couple of words to share with us. So, Doc.
Good evening. How are you? Thank you.
Great. How are you doing?
I'm well. Thank you.
And where are you streaming in from this evening?
I am streaming in from the lovely New York City.
Nice. Where the weather's, the sun is out, sun is shining, you're smiling, and we thank you for being here, and we look forward to your words of encouragement, inspiration, and education. Ladies and gentlemen, Dr. Tawana Guilford.
Yes, thank you for inviting me to the panel. When I was called to speak on the panel, it was with the utmost respect and humility that I speak. I have been actually speaking on numerous panels since the beginning of the pandemic, all throughout the pandemic, and certainly throughout the vaccine mandate. And I spoke on behalf of the healthcare workers who were reluctant and unwilling to receive the vaccine mandate. And I appealed to my community leaders and to hospital leadership to try to find accommodations for the healthcare workers. And the premise of that is during the pandemic, what my role was, I am a licensed psychologist in New York State. And during the first wave of the pandemic, I continued to provide telehealth mental health services to my patients. But when we did not have the hospital open to patients coming in, I also provided emotional support to the entire hospital facility. I worked in an acute care level 1 trauma facility in the epicenter of the pandemic. We saw our COVID numbers rise in epic proportions. And of course, our hospital staff were fearful. We had staff members pass away from COVID. We had staff members who contracted COVID and returned back to work, and they persevered. And I must say, I must be responsible in saying that we actually saw more survivors than casualties. We saw more people who survived the COVID-19 pandemic than the people we lost. And our frontline workers, our hospital staff, whether they actually provided patient care or provided other services, they were brave and heroic. In spite of the pressure to not take any time off and to return back to work as soon as possible, or to not take any time off from work, just to be support to others and just kind of push through with no end in sight, they were heroic. Yeah, we banged on pots at 7 p.m., but was that enough? And we were looking for something. So 1 year out, as we fought through the PPE shortages and worked through the guidance, the mask guidance, the hand sanitizer guidance, the opening of the restaurants, the soft openings, and all of the different permutations of how to maintain safety, the vaccine rollout came. And then all of a sudden, our heroes turned to zeros. And they were giving very firm guidance and very firm directives that either you take this vaccine or you lose your job. And that wasn't fair to our heroes because there was no vaccine in sight. When many of the hospital workers had to separate from their families in order to work, in order to put food on their tables, many hospital workers opted to stay in hotels in order to keep their families safe, but also to maintain their commitment to their hospital families. I mean, it was not a choice. They did what they thought was right. They took oaths, they made promises, they had commitments to both families, and it was a no-brainer about doing what was the right thing. So moving forward, 1 year later, their practices, whatever it took to keep themselves healthy, were not taken into consideration. It, whether they had antibodies that persisted all throughout that time period from when they had contracted COVID or had been exposed to COVID and still had antibodies that were lingering, or whether they fought COVID and had T cell memory, none of these discussions were had. Whether they drank ginger concoctions, turmeric concoctions, lemongrass concoctions, none of their regimens were ever considered by hospital leadership as to what kept you healthy during this pandemic and whether you remain committed to keeping this regimen going if you're not willing to take the vaccine. None of that discussion was ever explored. So I spoke with leadership in the community because first and foremost, I'm a psychologist and an advocate. And that's what led me to this field, being able to use my platform and my degree to advocate for people, the most high and the people that are living on the fringes. And I am unapologetic about the advocacy that I do for people because I believe that when people feel safe and secure and supported, you see their best. And we began to see people with rising levels of anxiety at all levels. We began to see people actually choosing, and it wasn't a large number, but we saw people actually taking firm stances on saying, no, I am not, hands off my body. Because what worked for me before to get me through this pandemic, I am absolutely going to continue that regimen. And for myself, no one was able to guarantee that the vaccine was going to continue to allow my body to do what it was naturally doing, which was elevating my level of antibody every time a new variant came out. So every time a variant came out, my antibody level would rise, as opposed to being depleted, which initially they said your antibody count would be depleted after 3 to 6 months. It will wane. That didn't work for me. And I spoke with many, many medical professionals. I looked at multiple forms of research. And because I wasn't able to get an actual answer, I said no. And I kept my record for over a year. And because I have underlying conditions, my personal doctor was willing to work with me and supported me because he knew my history. And that was one of the things that was missing from the conversation, that people's personal relationships with doctors and that level of autonomy and those relationships that existed were not considered. So my appeal still exists. We need for the government to be responsible and hand those conversations and hand the actual health, the actual medical pandemic and the medical crisis back over to the doctors and give the public some guidance on how we can move forward with this pandemic. Because currently we see a nastiness that exists in society. We still see confrontation. We still see competitiveness. We still see a hostility that exists with people about haves and have nots, wrong versus right. And we need the government to be responsible to the people because they created that divisiveness, and we need for them to heal us and to restore us.
Thank you, Dr. Tawana Guilford. I really appreciate you sharing that. It's important, and we need to be more educated and more involved in what is going on. So thank you so much. I'm in New York as well, so I hope to see you soon. We appreciate you. We love you, Dr. Guilford. Thank you so much.
Thank you very much. Thank you for having me. Have a
Yes,
good
ma'am.
best wishes to everyone.
Yes, ma'am. So right about now, we're going to keep this thing going, and we have an amazing speaker coming up. Please welcome to the stream, Eric Yaverbaum. Eric, how are you doing today?
I'm doing great. Thank you so much for having me. It's really an honor to be included. Thank you.
Appreciate you. I'll let you take it away.
Well, for the last several years, I kind of became like poster child for having COVID. Not intentionally. I've had it 3 times. The first time that I had it, my story was told all over the world. And my story, which very much goes along with my entire philosophy of leadership throughout my life, and I've written 8 books on the topic, is that, and I got this all from Mr. Rogers. I don't know how many people who are listening will remember Mr. Rogers, but in 1969, he gave testimony before Congress. This is before there was a PBS. Nobody knew who he was. PBS was, a non-player. And he said that in times of turmoil, if you look for the helpers, you'll know there's hope. That's all I want to be. I want to be a helper. And I know, because of my public platform, mostly in mass media, that people can look to me and know there's hope. And, you said this too shall pass. Yeah, it will pass. But somewhere right now, if you want to figure out your life, figure out what your worst day was, and I'll tell you, it was probably actually your best day. That's the day that changed you. And if you're feeling like there's no way, this would be a really good time to find a way. And the biggest question, I think, for people is, how do you enjoy the space between where we are now and, where we might be going? And all of this illusion of control, that's what it was. It's an illusion. Everything that you were worrying about being gone tomorrow, it's gone. It already is gone. It's a different world, but it's a world that we can all do good in, that we can all get together on. Not the political divide that's been going on in this country for way too long.
I appreciate that. As I'm listening, I agree with you, and I have to ask you, Eric, for you having it 3 times. First time, was it very severe? And
yeah, first time was very severe. I was on oxygen. They wanted to put me in a hospital. I opted out, which I'm glad I did. I would have been on a ventilator. I was on oxygen for 89 days. They told me my lungs would never get better. I'm an avid athlete. My lungs, lo and behold, they got better. And then I got COVID again. Nothing like the first time. And the third time was just a month ago, and it wasn't, I had a bad 5 days. Nothing like the first go round. And in the first go round changed literally everything about my perspective from waking up in the morning. You got up this morning, it's a damn good day. Plenty of people didn't. So for all of the things that we look, the anxiety is running rampant throughout society. Culture has changed dramatically. There's actually a war going on right now and a pandemic. Like, those are real things. I get up in the morning, I cannot believe it. Another 86,400 seconds. We all get them exactly the same. Exactly the same. We get to pick what we want to do with them. I'm taking them, definitely. I'm 61 years old. I am not missing one damn moment ever. And, COVID was I don't want to say refreshing, but sobering reminder to me of what's important. Look, we're all going to the same place in the end anyway. You want to do the same thing. Tonight, I'd like to have dinner. I'd like to sleep in a bed. Hopefully my air conditioner works. We want the same exact things. To categorize us as haves and have-nots is, we're all in this together. We should all be helping each other. And if there's somebody that you can lend a helping hand to, do it.
You make 61 look good. And I say it all the time when I wake up. Waking up is half the battle. And I wrote a book about it. It's called Yes, Every Day Can Be a Good Day. Because
That's right.
Can be. When you wake up, everything else is just icing on the cake. Eric Yaverbaum, ladies and gentlemen. Eric, thank you so much.
Thanks for having me.
Have a good one. Amazing words. Sometimes we just have to hear them over and over and over again just to get it. So we appreciate Eric sharing his time. And right now we're going to keep it going. We have another amazing person coming to the stream. Please welcome Tamika Morrow. She's a nurse practitioner from Synergy Health and Wellness, Chief Holistic Practitioner. Ms. Tamika Morrow, welcome to the stream.
Thank you. Thank you so much for having me. I'm really excited.
I'm glad to have you here. So I'll turn it over to you and you can speak to the people.
Okay, well, hello everyone. I do have a few questions I'm supposed to answer, but I want to just start off and let everyone know you do not have to live in fear, and you definitely don't have to be afraid. We talk about the whole pandemic and where it originated from. This COVID virus that we're seeing right now, SARS-CoV-2, it actually originated from a lab, and that's the truth. Dr. Fauci and scientists have been exploring and tampering with this virus for years. I even recall back when President Obama was president, they were tampering with the virus at that particular time. And then what ended up happening, you had over 200 scientists pull out. It was a study called gain of function. So gain of function is a type of study where they take a virus that only impacts animals and they try to, mess with it to make it impact human beings. With the whole goal, as they say, that if it was ever used as a bioweapon, then they would know what to do to save the people. However, these scientists pulled out and they said that it was unethical to continue to do gain of function studies because one misstep can lead to a global pandemic. So at that point, President Obama shut it down, and this was happening right here in the United States. And then President Trump took over. They got it started again. Then President Trump shut it down. And then that's when Dr. Fauci partnered up with his scientists over at the Wuhan lab, took it over to the Wuhan lab, and here we are today. So coronavirus is typically a virus. They call it a zoonotic pathogen because it only affects animals. However, they then tweak the virus to make it infectious to human beings intentionally on purpose. So that's where it originated from.
So let me ask you a question. You've been doing it. My wife is a physician assistant.
Mm-hmm.
You're a nurse practitioner, and you all have been on the front lines from day one.
Yeah.
We're talking about it tonight, Plannedem-MIC.
Mm-hmm.
When you were in there and we were getting ready, and I know my wife was telling me, go to the store, get these things. And, even I was kind of hesitant, like, it's not going to be that bad. What you were on the front lines from day one. For you, where we are today, do you feel like we got there gradually? Should we've gotten here immediately, or should we have not been here at all?
For one, we shouldn't have been here at all.
Okay.
But once we got here, this could have been eradicated when it first started. See, this is SARS-CoV-2. There was a SARS-CoV-1 that came out early 2000s. At that particular time, they did some studies to find out what they can use to treat it. They found out an old drug that's been around for decades called hydroxychloroquine, that if you take it, you can take it once every 2 weeks to prevent the infection. Or if you got the viral infection, you can take it once for twice a day for about 5 days and it'll take care of it. But you had the opportunity to eradicate it from day one. But the powers that be stopped us from having access to it, even went as far as threatening our licenses if we prescribed it, and then went another step and empowered the pharmacists not to fill our prescriptions so people couldn't have access to something that could have shut down the virus, stopped people from dying from day one. And the reason being, to have something in existence that was proven to be effective, that way they couldn't get that emergency use authorization for those experimental injections that they're giving out now.
When I was hearing about patients getting on ventilators, and I don't know if there's a myth to this. I don't know if there's a mystery to this, or if this is fact, that people of color were being taken off of ventilators because we didn't have enough ventilators to go around, and the elderly were, for lack of a better word, sacrificed. What are your thoughts on that?
So that is true. In regards to the people of color being taken off, I don't know about that part. I don't have any data to support that. But I do know a lot of hospital systems around the world were neglecting the care for elderly. They thought that they lived long enough, and they thought they were dispensable, and they refused to treat them. They refused to put them on ventilators and give them anything to sustain their life. And that's a given. I mean, you even have a big hospital system here in Michigan that even went on record to say that.
Wow. I don't know what to say. I know that I thank you for being on the front lines. I appreciate all that you've done. What can we do moving forward from your perspective in terms of our health as our communities are high blood pressure, heart disease? What can we do? Because it seems to be we are the ones that are affected because of these pre-existing conditions.
Okay. Well, a few things I want to say. I want everybody to rest assured that COVID, the virus itself, is not fatal. It's not deadly. Even at the height of the pandemic, you still had over 99% of people recovering and going on with their life. The main thing that killed people the most was the remdesivir. Remdesivir is it's not an old drug, it's a fairly new drug. They actually started doing a study on it back in 2018 over in Africa for Ebola virus. And that study concluded in 2019. What happened at that particular time? The people who were randomized to remdesivir, majority of them were dying. And so the powers that be in Africa stopped the use of remdesivir because people who got on remdesivir was dying. It was blowing out their kidneys. It was blowing out their liver. Dr. Fauci, CDC, NIH was all a part of it. They were even contributors to it, financed it. And so it was published in the New England Journal of Medicine, if you don't believe me, in December of 2019. Fauci went and took that same medication and made it the standards of care across the country. So why were people dying? Because he was giving them a lethal drug. And then he was putting them on ventilators. They didn't have to go on ventilators because at the end of the day, ventilators prior to COVID, you have at least a 20% success rate of getting people off ventilators anyway. So they were paying hospitals like over $30,000 per person that they put on the ventilator. Like it was really, really crazy. Just incentivizing the hospitals to put that in their standards of care. So the main thing about COVID that I want everybody to know, 3 things. He's talking about living and where do we go from here? The 2 main complications with this virus is 1, blood clots, and 2, pneumonia. The main thing you have to do fully, like 100% truthfully, I've treated thousands of people all across this state, even, helped out some people in other states. If you get COVID and you're not allergic to aspirin, 325 milligrams once a day after you eat. That is enough to mitigate that whole cytokine response where all those clotting factors and stuff start happening. You can shut that down and not even have to deal with it. You would do that aspirin, 325 milligrams for 2 weeks, and you ain't got to worry about that. The other thing is pneumonia. We've been treating pneumonia for decades and for centuries even. Just antibiotics, a Z-Pak has been effective. And if Z-Paks didn't work, doxycycline was an antibiotic that I used in my patients. It worked just fine. No one had to go to the hospital that treated, and no one died. And so moving forward, our best interest for ourselves, especially in our communities, we have to change the way we eat. Because what put us at high risk is because we're already inflamed. We're inflamed from the foods that we eat, the stuff we put into our body, the sodas, all the artificial colors, artificial flavors, the high sugar, the genetically modified organisms. It's terrible. So changing how we eat more fresh organic fruits, fresh organic vegetables, doing seafood that's wild caught. If you're doing chicken, make sure it's organic, doing those healthy fats like olive oil, taking omega-3s and getting your vitamin D levels up, because they found out people whose vitamin D level was 50 or greater, it actually gave them protection against the virus. And if they did get sick, it was very, very mild. So those are some things that we can do so we can fortify our bodies, our God-given bodies, to make sure our immune system is optimal and we don't have to fall prey to the next virus that they try to put out here.
Tamika, thank you so much for sharing that. We could go on and on, but I feel like you gave us a great foundation for where we need to start and where we need to actually go moving forward to take care of ourselves and our community. So I thank you so much. I appreciate it. God bless you. Love you so much, sis.
Thank you. Bye-bye.
So you heard it from Tamika Morrow. We have to take care of ourselves, educate ourselves on what we put in our bodies, and also what we put in our minds. So right now, it is time for another performance. I'm super excited. I heard this gentleman. He is really, really dope, and I'm excited to see this performance. So, ladies and gentlemen, please welcome to the stream, G Mims. G Mims, what's going on?
What's good, my brother? How you doing, my brother? How you feeling?
I'm feeling great. I'm excited. I'm even more educated than I was before I got on the stream.
That's great.
And now I'm excited to see you bring this music to life with a live performance. I'm gonna let you take it away, ladies and gentlemen. That is G Mims. The song is Plannedem-MIC. Here it is. Take it away, G.
G Mims. Right. COVID-19 is a plandemic, baby. What up? Right. COVID-19 is a plandemic, baby. Seeking to ravage through your community's immunity. Don't get it twisted. This a viral act by the enemy. It's very deadly, even lost some close friends to me. I'm so discontent, I can't pretend to be happy with what's going on with human beings. Plandemic, a pandemic, I hope that you deceased. I wish that you was in a chokehold, yelling I can't breathe, then hooked to a ventilator without a remedy. This virus is real for those who don't believe. Take your life without your will like cop brutality. I heard the hospitals getting money for casualties. It's big business over bodies, that's reality. Man, don't let them fool you. Behold the devil vaccine, they trying to use you. Airborne depopulation techniques, ain't no empathy. The plan is to kill us both, you and me. And this ain't right, Bill of Rights are in a frenzy. The people gotta fight the stage tree, let's make it trendy. Right, COVID-19 is a pandemic, baby, ravaging our immunity. So stay protected, eat healthy, vitamin C and D. It's no control, it's tax, old, young, strong, and weak. Yeah. Complex disease. Plan is to keep us all up under siege, kidnap humanity, destroy society. And you see what it's doing to the economy? Right. COVID-19 is the pandemic, baby, ravaging our community. We gotta strive to stay alive right now, it's do or die. Cause COVID going wild, so wear a mask and sanitize. Cause these are wicked times. And COVID-19 has no conscience or no care time. So protect what's inside. G-Mims. Plannedem-MIC. Shout out to Dr. Ford, man. Thanks for having me. Mass Consciousness.
Thank you.
It's an amazing platform, and it's an amazing message, very strong message, and I'm just proud to be a part of it.
Well, we appreciate you, and I know we're going to have you back in a few minutes to talk about the inspiration, the motivation. We're going to talk about the video. We're also going to be premiering the video, so I know you're excited about that. Ladies and gentlemen, that's G Mims, and he'll be back. We'll see you in a minute, G.
I see you later.
Ladies and gentlemen, now coming up to the stage, we have another speaker who goes by the name of Dr. Bill Sofsky. Please welcome Dr. Bill Sofsky to the stream. Good evening, Doc.
Hello, good evening. Thank you very much for hosting this. It's a magnificent group.
Thank you. Thank you. I'll let you give us your perspective, and then you and I can engage in some conversation.
Yeah, my wife and I had been railing against how humans are getting disconnected for years once we understood sort of how the nervous system really works to connect the body and mind and connect to each other. And then COVID happened, and our friends were all saying, oh my gosh, here is a worldwide test of the theory that you guys got published, peer-reviewed and everything, and it's really working out that way. The premise and the problem is that humans are the most elaborate communicators on Earth, and we have been for 1 million years. We've got eyes, we've got hands, we've got ears, we've got bodies. We're the only ones to stand on 2 feet, leaving our hands and our voices to connect. And that was how it worked, even before words went. Our faces especially. There's eyebrows, dimples, teeth, lips, tongue, eyeballs, brow. It's like so much muscles on the front of the face that we aim at each other, and we appreciate being aimed at us. And when kids are growing up, they get that serve in return, the feedback. It's megabytes. Words are only bits. Our faces and our bodies commute megabytes. That's real bandwidth. That's what we measured. And touch is even more important, especially for kids. So that motion, singing, and play, what humans evolved for was not words and not digits. And then COVID happens. Instead of being curious and happy, we're fearful, we're cooped up, we're stressed, we're afraid of other people, which is a weird thing for a social primate, not touching other people, not having company, and worse, especially for children, the faces are covered. Their faces don't matter to other people. Their parents can't even tell if they're afraid. And so when your face is covered, you lose the muscular feedback of what shape your mouth is. You don't feel fresh air or wind on your cheeks. You don't see other people's faces. They don't see you. You're not being seen. And so children are at this learning stage where they're trying to learn how to use their bodies, and they're trying to learn what it means to be an emotional connecting person. And they've been blocked from it. They're in burqas. They're not going to get COVID outdoors. We're probably not going to get COVID at all. So ultimately, we need to figure out what to do and how to be different, knowing how important physical proximity is.
Now, psychologically, how do you think that affects children? You just brought it up and covering their face. For our young people, what does that mean long term for them?
Well, it's a kind of learned helplessness that for any learning system, if you don't get enough training data early enough to be confident what you're doing, you back off. You back off and go slow and don't do that dangerous, scary thing. Unfortunately, if that dangerous, scary thing is looking your mom in the eye, and now you're averse to looking anyone in the face and you're scared and you don't want to do it, that's kind of a vicious circle. And so that's why we need to know that social anxiety is a kind of a toxin. Social aversion is not healthy. Not looking at people and not wanting to be around them is not what our nervous systems can deal with long term. It's like eating saccharin and thinking you're getting nutrition.
What can we do to curb some of this anxiety? Because I feel like the adults have it, and now we're passing it on to our children. What are some triggers that we can identify, and how can we combat those?
Well, the simple, the anti-COVID thing, the what can we do to be safe from COVID, which other people haven't already said, is to pay attention to airflow rather than masks. Because if there's open windows and you're upwind, it's just completely different. Make sure you're in a big space. Learn to breathe, learn to feel what breath is like so that your body can locate that yucky stuff and cough it out. Having a dry cough with pneumonia is a bad idea. And that means yoga and meditation and so forth. So you can practice being healthy as a thing, but most importantly is practicing being happy by actually doing it. And that means getting offline, not exposing yourself to sources of anxiety, which might be fake. I mean, real anxiety, we got plenty of real things. Don't go for the fake stuff too, which means a lot of news. It means getting outdoors. It means feeling fresh air, sunlight, cold water on your hands or feet or something, people face to face, and find somebody to touch or hug. That's what our species needs the most right now.
You're a biophysicist.
Mm-hmm.
What is your role in all that is going on with COVID, so that people understand? Some people look at that as a very big word. What is your role as a biophysicist, and what does that mean as it pertains to this pandemic?
Well, what I'd like my role to be is kind of different from what it is. Right now, science proceeds on grant money and paid for experimental evidence. So what gets published is what got grant money last round and what intends to get grant money next round, and what gets my name in print. Because if my name isn't in print, then I don't get the grant money and my students don't get it, my administrator doesn't, and all that stuff. This has been known by scientists, but the scientists are still being paid to be scientists. So I'm a kind of a renegade. I started a revolution in neuroscience 30 years ago, then jumped ship and became a Silicon Valley data scientist and the first algorithm officer. So I got to know neuroscience and then data science, and now I'm trying to come back with some of the answer. And my wife knows the narrative side of this too. She's leading an organization called Fair Play, which is trying to combat the children's mental health epidemic by reducing online exposure, educational technology, and other essentially pixelated poisons. What I would like my role to be is to point out how the laws of nature explain what we are doing to ourselves, not just by vaccines or things which pretend to do that, but also by pixels, by online advertising, by any kind of interaction which isn't human to human. All the other stuff standing between us takes a horrible tax, and it fools us into thinking it doesn't matter. Did that answer your question?
Fully. And I'm certain that answered a lot of questions for those who are watching. I appreciate it. Where do we go from here?
Well, if we have humans getting together in free space to talk about this. So if I or Cecilia were to join 20 people in a room who had a full day to talk about it and think about it, then the resonance between us, a kind of a spirit thing, could spin up. It's basically how our unconscious does the hard work. As long as we slow the conscious part down enough, and I'm the math guy, I can actually explain this to computer scientists. Throw a few Nobel Prize winners at me, really. I'll turn them around in 10 minutes. They're the easiest ones. But get a bunch of us in a room who respect science and also respect spirit, then we can connect them.
Dr. Sofsky, thank you so much. I appreciate you. I hope to see you soon in person, just so I can put my arms around you.
Me too. Me too.
We need more.
Thank you very much. It's been a pleasure doing this.
Thank you. Have a great rest of the evening. Ladies and gentlemen, that is Dr. Bill Sofsky. Some amazing information, some amazing insight. I'm going to bring in a guest speaker. I'm excited to hear whatever it is he has to share. I'm super excited. He is the founder and CEO of Warrior Sage. Please welcome to the stream, Satyan Raja, ladies and gentlemen.
Great to be here. Very honored in such a timely occasion. So thank you.
Thank you so much. I have to ask you, where are you streaming in from? Because I see the light, and maybe that's just your natural light, your glow, and the light is always shining on you. But where are you streaming from today?
I'm from outside of Vancouver, Canada, a lovely town called Langley, British Columbia. So yes, we're in the heart of sacred beauty and nature here.
Beautiful, beautiful. Now, tell me a little bit about Warrior Sage and how you've been contributing to allowing us to get through this pandemic and hopefully getting out of this pandemic.
You know, my work is in leadership. So my main aim is to help leaders become awakened, self-realized, and aligned so that whatever missions they have in the world, it's potentized from spirit, from soul, from total harmony, them and their teams. And, you know, I was in the time that we had to share here, I was feeling, you know, with the urgency and the depth and the gravity of our context here, how we're going to deal with all the inner turmoil. And so if I may share right away that the number one problem I see at a psychological, spiritual level, whether it's COVID, whether it's any illness, any disease, is ultimately our human personal fear of death.
Yes.
When we deepen and we can learn to love and accept our death, then whether it's COVID, a tsunami, a tidal wave, or natural passing, we're not going to be contracted within. We're going to be open and spacious and embrace life fully. Because if we just keep going away from the fear of death, it's whether we call it COVID, whether we call it XYZ, truly the end of it is the fear of death, the source. So we as spiritual warriors, all of us here gathered, when we can confront and face the fear of death, and then ultimately the fear of life, then what happens is that we conquer through our transcendence these things, our vibration raises, our immunity raises, our connection, our love force raises, and then life and death is going to come anyways. This way you're not in fear. Death becomes an ally, a friend, to motivate us, to give us clarity on how to walk the path cleanly.
I love it. Now, for someone who is not familiar with that, how do you begin that spiritual journey and that mental health piece to mentally be able to sustain that?
Well, we have about 3 minutes, and I thought if you're open to it, rather than talk about it, we actually go through a 3-minute meditation if everyone is ready.
If we could do 60 seconds, that'd be great. But you
okay, 60 seconds. So
right.
I want everyone to take this exercise at home today, okay? So we won't be able to do it today, but at home. Number one, I want you to feel, and you can write this down, what it's like at the beginning of your life. Go imagine yourself at the beginning of your life, even now as a child, the baby, and feel that. Now let that go with the breath and feel the end of your life. You're on your deathbed, loved ones gathered. Feel what it's like to be at the end of your life. Now go back to the beginning of your life. Go back and feel that once again deeply as a child, as a baby, full of life. And then now let's go to the end of life again. We're going to toggle back and forth, feeling our last breath, our last days. We've given and contributed and lived life fully. We are ready to release and let go. Feel the beginning of life. Feel the end of life. Now here's the secret. Feel both at the same time. The beginning of life, the end of life, and we take a slow, deep breath in and out. And what will start to happen is they will merge. They'll start to blend. So my good friends at home, to really transcend the fear of life and death, practice this daily. Feel the beginning of your life, the end of your life, go back and forth a few times, and then feel both at the same time. And notice what happens. What will happen is we will connect ultimately with our eternal spirit that transcends life and death will become far more fearless, and will become in our true sacred power to do the good work we need to do to move ourselves and life forward.
Satyan Raja, thank you so much. I'm going to begin practicing that. I love that. That was a breath of fresh air. And I think that those who are watching, those who are listening, they try it. Sometimes try is the operative word. Try it, see what works, see if it works, and see if it changes your life, your spirit, and your mentality. So I appreciate you. We appreciate you. Thank you so much for sharing what little time we had this evening. We appreciate you. We love you. Ashe. Ashe.
Ashe.
Coming up next, we have Dr. Victoria Nyo. Please welcome Dr. Nyo. I hope I pronounced it correctly.
You did. That's great. Usually people can't pronounce it, so that was great.
Doc, how are you doing today?
I'm good. I'm joining the New York City contingency, calling in from Harlem.
Oh, Harlem in the building. Oh,
yeah, Harlem's in the house.
That's what I'm talking about. That's what we need.
Yes.
That's exactly what we need. So, Dr. Nyo, please introduce yourself, what it is that you do, so we can get an understanding, and then I have a couple of questions for you.
Great. I'm a clinical psychologist and also an associate professor at the CUNY's Graduate School of Public Health. I also direct the Center for Innovation in Mental Health, and I apologize for my voice because I'm actually recovering from being sick. I just came back from Asia. So, yeah. And I've been actually working on mental health task sharing, which is interventions that are focused on sharing the mental health work with people who are non-mental health providers, faith leaders, community workers, healthcare workers, and training them to provide, screening, education, and simple, mental health interventions like problem solving, so that more folks can have mental health access.
I have a question for you. What populations and communities are the most vulnerable and affected by the COVID-19 disease?
Yeah. So one of the things we learned about COVID is that it's widening disparities. We saw, Black and brown folks more likely to be infected by COVID, more likely to die from COVID. And so you see the same thing with mental health, same sorts of patterns that, follow that. And a lot of that has to do with a lot of the social determinants. African Americans and Latinos more likely to have, employment risk, food insecurity, financial insecurities, and then all of that creates this vicious cycle. And we've seen that worsen during COVID. And then they're also more likely to be essential workers, more likely to be on the front line, more likely to be exposed and have poor access to care.
For you, what challenges or restrictions have COVID-19 had on people's mental and emotional health?
Yeah, that's a really good question. I think all of us have experienced it. COVID has been really stressful. It's turned our world upside down, right? It's requiring all of us to work, live, and connect differently. And usually after a community tragedy like that, what we do is we have to come together to heal. But with this pandemic, the public health intervention has been to have social distance, which means physical distance, right? To contain the infection. And this is in direct opposition with the emotional need for us to gather as a community, for us to be with our loved ones. And so that's been really hard because, these two things are in conflict. Then the scale of the pervasiveness of COVID has been unprecedented. We've never experienced anything like this before. So it's been really hard for people to cope. We're seeing it hit all around the world. And what we're seeing is, a greater rise in insecurity, right? People have had to change the way they work. They've had to work remotely. Schools have had to change to be remote. And there's so much that's happening, along with the insecurities related to the finances that's making things just very difficult for many folks. And it's impacting across all systems. So it's a confluence of all of these risk factors happening at the same time, and all of our systems being overwhelmed. Our healthcare systems overwhelmed, our mental health systems overwhelmed, our social service systems are overwhelmed. In fact, we just conducted a study in Harlem, and we found rates of mental health to be 30 to 40%. We found rates of interpersonal violence to be in the 60s, which is very, very high. And these rates are 2 to 3 times, what they normally would be, which would be about 20%. We also found really high rates of housing insecurity, food insecurity, and job insecurity. So basically, people are stress in so many different ways. And so that makes a lot of sense why depression and anxiety is rising. And also trauma, from seeing their loved ones pass, and just, the chaos that we experienced at the beginning of the pandemic and throughout has been very difficult. And now we also see a rise in hate crimes against Asian Americans and more crime as well. And, now that things are starting to open up, it is getting a little bit better, but there's still a lot of change that's happening. So those are all the reasons why mental health is in a crisis. Basically, we have a syndemic of pandemics happening. So multiple things happening at the same time. So the most vulnerable are going to be even vulnerable now.
Let's talk coping mechanisms and solutions. From where you sit, what do you recommend?
I think we need to think differently about strategies to support mental health. We need to think at the system level. We need to think at the organizational level. We need to think at the individual level. There are just not enough mental health providers to serve everybody. That was the case prior to COVID. It's worse now. This treatment gap is huge. And, for many of us, we don't even see mental health. It's invisible. But, mental health is going to cost our country $14 trillion between 2011 to 2030.
Wow.
People are more likely to be absent from work because of stress and anxiety than because of physical illness or an injury. So that's huge, right? And so what we need to do is develop new models of care to reach the more communities. And one of the things that I'm doing in Harlem actually is called the Harlem Strong Initiative. And what we're doing is we're partnering with community partners, community leaders who are helping us re-envision what we think, can be done for mental health and integrate mental health services into all different types of places, from churches to primary care to housing, and social services. So people are already going to for help, they are already the de facto counselors, but without the training. So what we're doing is providing them with what we call mental health task sharing, which is teaching them, basic skills to screen depression and anxiety, so they can identify those folks and support them with some education around mental health, and then stress management skills, self-care skills. So there are things we can do as people are, beginning to get very depressed, to start earlier. So we move on early intervention or prevention work. So that's, I think, one thing we could do at the system level, because we really need everyone to be a mental health promoter and a mental health advocate in order for us to really address this gap. The second thing we can do is think about, the work. Americans work more than the average person in the world. We work so much, and a lot of stress is happening in our workplace. So there needs to be more workplace wellness programs. We need to be integrating that into our workplace. That would be an easier way to reach people, because more people are in that setting, and that's the setting that's causing a lot of stress. Another is focusing on our healthcare providers, our social service providers, and our human service providers, because they are the front line. If they're stressed out and unable to take care of themselves, they're not going to be able to serve others and support others. So we need to think about them as well. And then, from an individual perspective, I think paying more attention to ourselves and doing some of the things that some of the earlier speakers mentioned in terms of self-care and stress management, paying attention to your emotional needs, being present, returning to some of the basics, like taking care of your sleep, making sure you're resting enough, making sure you're eating well, making sure you're taking care of yourself, you're paying attention to your emotional state. And then, introducing ways to create some calm and peace in your life. So that might be yoga, that might be meditation, that might be a simple walk. And so these are some simple strategies that people can start to incorporate into their daily living. And that, seems simple, but it actually is very hard. So many of us are just on, go, 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 right? And so we don't stop to pay attention to ourselves. Even when we know we should, we don't actually make it a practice to do so. And so, I think working on making it a practice to do so is really important. And lastly, and most importantly, staying connected. Being connected to folks that you love and love you is so important. And finding ways to disconnect from, technology and connecting in real life, and, basics. These are very basic things that I think if we promoted more, we will help more and be able to, take on more prevention, basically, rather than waiting for things to get so severe that people have to, get services in mental health settings. So that's that's what I think.
Dr. Nyo, thank you so much. I appreciate it. Sending you love, and everybody else in Harlem World, we love you. Thank you so much.
Thank you
for sharing those things, and I hope that whoever is watching and listening takes some of those tips and we use them. And we appreciate you, and we hope to see you soon. No masks on, hopefully, and we get to love on each other like we once did before. So thank you so much, Dr. Nyo. Have a great rest of the evening.
Bye-bye.
That was Dr. Nyo giving us some tips and some things. So right now, I'd like to bring in our next speaker, psychologist with a specialization in psychological and educational assessments. Please welcome to the stream, Dr. Sanam Hafiz. Dr. Hanam, how are you? You're on mute.
Hi, I'm well. How are you?
I'm good. Thank you so much for joining us. I'll ask you, how have you been throughout this pandemic?
It depends which day of the week you're asking. It's been kind of a journey for all of us, right? Because the first few weeks, I remember doing specials on the coronavirus on TV. No one's wearing masks. We're taking selfies, and I'm saying, yeah, I don't think we're supposed to do this. And then, it blew up. I'm in New York City. I live in Queens, New York, and we went through some really, really tough months, and it was really depressing and anxiety provoking, and really made us all, I think, on some level, take stock of our lives. And even when things were going well, it was really, personally, when they were going well, it was really hard to enjoy life when you saw so much death and misery around you. So I think we've come a long way from there. The vaccines and I guess the virus even morphing into maybe a less lethal strain. I'm grateful for all of that.
From where you have sat from the front lines, what are some common psychological issues that people have demonstrated because of COVID-19? For example, difficulty sleeping. What else has been demonstrated that you've seen while on the front lines?
Well, even if I wasn't telling you my own personal experience as a psychologist in private practice, I can tell you that my practice is busier than it's ever been. And even if you took out of this huge of people struggling with anxiety, depression, ADHD, sleeplessness, drug abuse, alcohol abuse, the CDC estimates that 1 of 4 Americans are depressed. Suicide rates have risen sharply. I think the country is really struggling. I think we didn't see a lot of these things necessarily coming as a nation, but as a psychologist, I could have told you that people struggled with so much, and they had buffers in place. Going to work was a buffer. Going to family dinner on Sunday night was a buffer. Being able to just get up and go to a show or movie was a buffer. It got ripped out from underneath us. And suddenly, when all these buffers were taken away, we had to come to face with our own reality, with our own shortcomings, with any unhappiness, anything we'd been sweeping under the rug. And, Dr. Nyo, I think earlier from CUNY, made a very good point that, there was already a dearth of mental health professionals in the field. And now, because there are so many people needing it, I, as a mental health provider, can't sit here and tell you that I have an easy time referring people. I don't know where to send people for therapy, for medication. And they come back to me and go, Dr. Hafiz, we call the people that you referred us to, they no longer take our insurance, or they are booked up for 6 months. Where are we supposed to go? So we've got, a lot of things in play right now. And I think the problem is, again, we're talking about on the systemic issue and the global issue, we this is part of what happens, when you work from home. When we talk about the global issue, I talk about this quite openly now. There's a lot of funding that's available for mental health causes. The problem is it's not making it to the right people. It's not making it to the small business, the small practitioner in the community that people trust, that people can go to. And that's what needs to change. The small, the average doctor so-and-so, a therapist so-and-so, the community centers, they need to get funded so they can get help to the right people.
I want to turn our attention to our young people, especially, I want to say elementary, middle school. What clinical observations and symptoms have our children displayed because of COVID-19?
Oh, there's so many children that have hurt so much. Firstly, they went from being in a classroom to being on a computer, right? This,
Right.
I still don't enjoy this. I still would rather be physically present somewhere engaging with people. So I think a lot of children suffered because they suddenly had to deal with learning, not really in a classroom at their kitchen table, with their moms also working and having to mute people and running to help you, with dads having to, make you breakfast because they had another meeting. And if you were a single parent household, I mean, God bless you, you really struggled during that time. Or if you were a first responder and you had to go into work, you really struggled during that time, right? So there were a lot of other stressors that kind of got like fell by the wayside. But I think children struggled because they didn't have the support of having a teacher or a friend in the classroom. They had to support themselves, click on and off Zoom. They had to submit work through Zoom or through some online app. And so some children really missed their friends. Some children forgot what it was like to be in a classroom. Some children said, "Hey, you know what? Well, it's not so bad. I didn't quite feel understood or accepted in my school. This computer thing's okay." And now we're like, "Well, go back into the classroom." And they're saying, "Yeah, no, thank you."
Good.
Yeah.
Yep.
So I've got a lot of patients, adults and children, who are refusing to go back to work, refusing to go back to school. And, and when I get to understand their history, this was a long time coming. They just never thought that was an option. So, as grateful as I am for having this virtual world, because it's allowed us to keep moving on, it's also hurt us a lot as just a species, right? We weren't meant to do this on a screen. We were meant to do this in person. And so, the pandemic has really wreaked havoc on so many of us for so many reasons. And in some ways, I think there's some good that's come out of it. I think there are people who have made big changes in their lives because they've said, you know what, this isn't working for me. And it took a pandemic to show me. Or they moved in with a loved one and said, I got to spend time with my loved one. I have a neighbor who lost her 100-year-old mother. And she said, when the pandemic happened, I just moved in with her. And she is so happy that she got to spend the last couple of years of her life, her mom's life with her. So I think that there is, if you're looking for it, you can find the positive in this as well. But, if you've lost a loved one to COVID, it's really hard to find that positive, and it hurts.
It is. And we've been hurting for far too long. Since let me word this right. Anxiety, stress, worry, all these things, all these factors can weaken the immune system. What kind of coping mechanisms and recommendations can you suggest or provide that will allow those who are watching and listening to take into practice to help them overcome this anxiety that we are now beginning to? I think it's just, I want to say it's not just regular anxiety. It's COVID anxiety. It's not seeing your family, not seeing your friends, not really seeing your children. It's losing loved ones, losing friends. What are some of the coping mechanisms that we can learn from you to help us so we can make sure our immune system is strong in the event that we catch COVID-19?
So I think, one of the things that I learned and actually put into practice every day was get vitamin D, get some sun. We suddenly stopped going out and we weren't getting enough sun. And there were some studies that implied or indicated that you were more prone in countries where you weren't getting enough sunlight to have greater rates of death from COVID, whereas there were plenty of countries that, had COVID but were reporting fewer deaths. I mean, we thought the sort of the poorer, impoverished countries would be devastated by COVID, and yet they weren't. Right? I remember thinking, oh my God, what happens to poor countries in Africa, in Asia, countries that are already having issues with healthcare, with nutrition, with all kinds of problems, war-wrought countries, and somehow we the wealthy Americans suffered the most. And
Right.
so obviously there's some factors that I feel like research for the next a couple of decades will continue to show us. But I think so. I learned this, and I found a little spot in my kitchen that gets a lot of sun in the morning. And I sit there with my cup of coffee in the morning and I just soak it in. I just soak in 20 minutes, 15, 20 minutes of quiet time and the sun. And to me, that's self-care. I pick up my New York Times, I read that in the morning, unencumbered by my phone. That's self-care. I go for a walk with my children. I try to just have some downtime with my husband. And I care a lot about those things. I don't know if I cared about those things as much as I do now, because I think the pandemic made me realize how important it was for me to carve out that time for myself.
Dr. Sanam Hafiz, thank you so much for sharing those gems. We appreciate you. Sending love and light to you and your family. And that, please, I hope to see you soon. All the way from Westchester to Queens, we're sending you love. And thank you so much for sharing your evening with us. We really appreciate it.
Thank you for having me.
Yes, ma'am. Yes, ma'am. Ladies and gentlemen, that was Dr. Sanam Hafiz. This evening has been amazing. Next speaker after next has been giving us gems and giving us coping mechanisms and giving us things that we can incorporate in our everyday lives moving forward. So we thank them. Right now, it's time for an interview with the one, the only, the hip hop artist that goes by the name of G Mims. G Mims, what's going on?
How you doing? How you doing, June Archer? Pleasure to be here.
Man, it is a pleasure to have this opportunity. It is a blessing. And I want to ask you, for you, we know what the inspiration is, but from where you sit in the environments that you walk through, how has it affected those who you come in close contact with?
I mean, there's different levels of effect. It's affected us and me and my family and my loved ones physically, mentally, and I even want to say emotionally, right? Because over the last 2.5 years, we've had to kind of live under different circumstances, not just the fear of COVID, but we're inside more, you know what I mean? We're a little distant from people that we're used to seeing on a daily basis. It's become a mental transition, you know what I mean? And a lot of people that I know as well, including myself, had to deal with learning ourselves in different ways and learning each other in ways that we never really had to, because we always had our common life habits distract us from dealing with one another on a more intimate and daily way, so I think it's changed everybody around where I'm from to a certain degree. The common handshake doesn't feel as comfortable anymore, and you realize how important those little means of body language means to our day and to our emotion and to our uplifting of our day. And I used to play sports, and I don't mean to overtalk. I used to play sports, and it's something about a handshake or a five that kind of picks your spirit up.
Yeah.
And not being able to embrace a person physically without having a mental block or worry of a germ or of a spread of a virus is it's tough to deal with, you know what I mean? Because that unspoken language is important to our to ourselves as humans.
You're picking up the torch for hip hop with creating this song and shooting a video for it. How do you feel the hip hop community is learning about this pandemic? And do you feel like the information, the treatment, mental health is getting to the inner city or those in hip hop, those who are in love with the culture? Do you feel like they're at a disadvantage? Do you feel like we're getting the information? Can more be done? What is your perspective?
I feel like there are many messages getting across, and there's plenty of resources to to self-inform. But you know, I do think there's a little bit of filtering from the true messages that we need. You know, I mean, I'm listening to a lot of the conversations that you were having in between my performance, and you know, even when the last lady, I don't want to mispronounce her name, the woman that came on right before me, I was asking what her name was because I didn't want to mispronounce it, so I'm not going to make that mistake and say it wrong. But the one,
Dr. Sanam Hafiz.
Dr. Sanam, yes. When she talked about like sunlight, you know what I mean? I saw a video about how much people of color are vitamin D deficient from just what comes from the sun. You know what I mean? We work 9 to 5s. By the time we come out of a job, out the shelter of a workspace, the sun is down. You know what I mean? We miss the sun most of the day for about the average of 5 days a week. And then it might be cold if you're from where I'm from. You know what I mean? The weather might determine some other days. So we miss a lot of natural remedies to the things that we go through just by living what we call life, our version of life, and working and paying bills and we really miss, you know what I mean? When's the last time, whoever's listening that's from the city or from where I'm from, that you take your bare foot and just step on grass and just let the sun feed you? When's the last time you did it? It's probably, if you're from the city, yeah, it's probably been when you were a kid. Right. You was at the beach somewhere. You know what I mean? You was in the South at your grandmom's backyard or your mom's backyard. But where I'm from in the city, we got concrete. Who's stepping barefoot is glass, is dirty. You know what I mean? That's the mentality that we got. Well, I'm from where it has trained us to believe, and we miss a lot of natural remedies that the earth has already provided for us as people. And, you know, I try not to get too caught up in that. So when you ask me about hip hop and passing the torch, it's important that we kind of share information. Songs like the Plannedem-MIC are generally uncomfortable songs. You know what I mean? They're generally uncomfortable songs to perform and to present to, I don't want to say hip hop crowds, but just the hip hop world in a sense. Conscious music tends to get put in a room and boxed, and you got to kind of be a conscious this or a conscious that to get that music, and when it should be exposed like mainstream music, because there's definitely a message that I think people of integrity want to hear, and even children that are curious about more information want to hear. So I'm just glad I got to do something and make it a message that speaks to a large people. You know what I mean? This is affecting us on a daily basis, and sometimes we need just direction. You know, we need good direction. So that's what this song was about. When I linked up with Dr. Ford, you know, you mentioned that I wrote it. Actually, I want to give credit to Dr. Ford too, because it wouldn't have been possible without him. He had the idea, and he had bro, he gave me these like 2 pages, 3 pages of like literature that he wrote, and you know, he was like, I don't know how to write a rhyme, but I know this is what I want to say. You know what I mean? And I was like, yeah, this is definitely not a rhyme, but it's, you know what I mean? I got the picture, you know what I mean? And his spirit, his energy was amazing. We kind of connected off the rip, and we had several meetings that allowed me to feel him and allow him to kind of like step in the booth, and me to kind of step in his, what do they say? What's that robe? That doctor's robe, you know what I mean? And to kind of give a perspective and give information to me and to people who are going to be exposed to the song. And it was a pleasure working with him and turning that, you know, adding my bars, adding my metaphors, adding my rap style to, you know, an idea, a concept that he had. And I was just glad to be able to bring it to life. Shout out to the producer Hassami too, because he took time out to play music to help me find a mood, you know. So those things was really key, and it took all of those special parts to make the song what it is.
Let me find out. Dr. Ford is a ghostwriter.
Yeah, Dr. Ford got some credits on this, man. He got some writer credits on this. He got some bars.
That's a beautiful thing. So G, Mims, let me ask you this. We have a slot for you to perform, and we also have the video premiere. I'm almost feeling like we should go ahead and just jump into the video. But I'm gonna let you tell me how you want to proceed, because I'm just excited.
I mean, you know, I already performed already, so if you want to see the video next, we could do the video next. Give the people some more visuals. Shout out to Rome. That video shoot was great. Shout out to everybody that was a part of that video shoot. The video shoot felt very powerful, and it was kind of like true. The truth is, the backstory is that video was really kind of shot right in the climate of still that heavy pandemic. Wear a mask. You know, wasn't too many people outside yet. You know, it was still that type of time, and that was a really dope video. So I hope everyone enjoys it, and yeah, shout out to everybody that was a part of it. So Plannedem-MIC by Dr. Ford featuring G-Mems. This the world premiere. Premiere.
So before we get into that, we have a special video from June, aka Cato Brown, who couldn't make it this evening, who wants to set it up for us. So we're gonna play that. We're gonna get in, and I want to remind everyone who is tuned in, watching and listening, the song drops this Tuesday, streaming on all platforms.
Yes.
Please make sure you go out and support this song, support this video. Dr. Ford, G-Mems, Cato Brown, everyone that's in the video is very important. Ladies and gentlemen, this is a word from June, aka Cato Brown.
Hi, everybody. This is Cato Brown, the director of the video. I want to congratulate Dr. Ford, G-Mems, and all the cast and crew who was involved in this. You know, we finally here for the world premiere. You know, we took some time finishing video. Everybody did a good job. So I just hope you'll enjoy watching this.
Look at that. Yes, doctor. You see it? The coronavirus.
Part of the pandemic.
All part
Excellent.
of the pandemic.
Yes, doctor.
Watch your
Yes, doctor.
I've done it.
You've done it, doctor.
COVID-19 is a pandemic, baby. COVID-19 is a pandemic, baby. Seeking to ravage through your community's immunity. Don't get it twisted, this a viral act by the enemy. It's very deadly, even lost some close friends to me. I'm so discontent, I can't pretend to be happy with what's going on with human beings. Plandemic or pandemic, I hope that you deceased. I wish that you was in a chokehold, yelling I can't breathe. They hook you to a ventilator without a remedy. This virus is real for those who don't believe. Take your life without your will like cop brutality. I heard the hospitals getting money for casualties. Big business over bodies, that's reality. Don't let them fool ya. Behold the devil vaccine, they tryna use ya. Airborne depopulation techniques, ain't no empathy. The goal is to kill us both, you and me. And this ain't right, our Bill of Rights are in a frenzy. The people gotta fight to stay free, let's make it trendy. Right. COVID-19 is a pandemic, baby, ravaging our immunity. So stay protected, eat healthy, vitamin C and D. This ain't simple, it's a real complex disease. No control attacks the old, young, strong and weak. Focus is to keep us all up under siege. Kidnap humanity, destroy society. And you see what it's doing to the economy. Right, COVID-19 is a pandemic, baby, ravaging your immunity. We gotta strive to stay alive, right now it's do or die. Cause COVID going wild, so wear masks and sanitize. Cause these are wicked times, and COVID-19 has no conscience, so no care time. So protect what's inside.
Yes. Yes. How's it feel?
I'm just proud, man. I'm proud. I remember that day. I'm proud of everybody that was a part of it. I'm just proud. I was just looking at that video going through the course of the day, remembering all the takes that we did in that day. It was a lot of work put in that day. I'm especially just thankful that the message got across, man. I'm just thankful the message got across. This is a beautiful thing that's going on right now. So I hope everybody enjoyed. It's for the people. It's not just for me. It's not just for my satisfaction. It's for the people to enjoy. It's for bringing Dr. Ford's vision to life. So I hope he's somewhere sitting, watching, and being proud and enjoying everything that's unfolding, man. This is truly for him and for his vision and to be a part of what mass consciousness has to provide today. So, you know, I'm just proud. I'm just feeling really proud. Today's my birthday too, by the way. So this
Happy
is a
born day, brother. We're gonna sing happy birthday where we are and wish you nothing but blessings on this born day, man. And that's got to feel extra special. So
yes.
super excited. Listen, I'm proud of you. I've been in the music business 25 plus years. I see the hunger in your eye. I see the passion. Brother, keep doing what you're doing. You are anointed. Don't forget to use your gift.
Thank you. I
Use
appreciate
your
it.
gift.
Lord willing, I will. As long as his will is done, I'm with it, man.
And you know that's right. So I'm gonna let you do what you do. Don't forget, ladies and gentlemen, this song and video, the video's dropped. That's it. You saw the world premiere, but the song is streaming on all platforms starting this Tuesday. Please make sure you pick it up. We're gonna be running everything on
this Tuesday, streaming on all streaming platforms. That's YouTube, iTunes, Spotify, Napster, anything you use, Google Music, Google Play, everything, all streaming platforms, any streaming service that you use, Tidal, it's up there. So June 14th, you know.
Awesome. Well, I'm gonna go thank some people. I'm gonna let y'all get ready. I know there's a performance coming up. So G Mims, thank you so much. I'm gonna be buying this song on Tuesday. As soon as I wake up, and I wake up at 6 a.m. So when I wake up at 6 a.m., I'm gonna get it. iTunes is gonna be in my playlist, and I'm gonna be playing it. So I appreciate you. God bless you. I love you, brother.
Real quick, if anybody want to look me up, you can find me on Cool G Mims, at Cool G Mims, cool with a K, KOOLGMIMS. And yeah, anybody that wants to tap into me further and my music or anything else and anything further with the pandemic, that we'll be having some other things going on. You know, just stay tuned and look out for more.
There we go. Ladies and gentlemen, that's G Mims. So you've seen a lot of great speakers tonight. We've gotten a lot of great information tonight. I really hope that whatever it is that you've gone through or continue to go through, I hope that tonight was a night where it allows you to breathe a little bit. It allowed you to get the opportunity to learn some things that will help you get through all that you've been through. And as we get ready for this last performance, I want to send a couple of acknowledgments out and some shout outs if we can. We want to thank Mandisa Hinton, Jerome Wright, Gregor Hubner, Grand Mixer DXT, Marissa Haynes, my girl MJ from MJ Hip Hop Connects, Rhonda Tharp, from Jersey Connects, LaShawn Jones from the Creative Jones Media, Tariq Nelson from Fame Academy. Thank you, Tariq, for making everybody sound good tonight. We appreciate you. Lena Brown from Lena Renee Music, Enoch Purnell from Prescient Photos, Cato Brown, who did the video. We thank you. The cast of the Plannedem-MIC video, all of the performers in there. Shout out to the whole Mass Consciousness team, especially the man who made this evening all possible and brought all of us together. Please give a round of applause to Dr. Ford, wherever you're sitting, wherever you're standing this evening. Dr. Ford, we thank you. We love you. Tonight couldn't have happened without you. The information that was shared with all of us couldn't have happened if you didn't bring all of these like-minded, beautiful, amazing human beings together tonight for the purpose of educating and celebrating that we have to realize that this is a pandemic, that this shouldn't have happened the way it is happening. And hopefully we get out of this sooner rather than later. We'd also like to thank Ahmed Smith Ford, and of course, the lady who's behind the scenes, making everything happen, calling me every day to make sure we were on point to do what we had to do. Please give it up for Miss Daphne Selby, ladies and gentlemen. We appreciate her. We love her. Daphne, thank you so much for choosing me. We appreciate you. And right now, we're going to throw it back to the studio for another performance. Thank you guys for tuning in. Don't go nowhere. We're going to play the video again at the end. But right now, we want to bring you back into the studio with G Mims.
Here we are. Let's go. Let's do it. Right. COVID-19 is a pandemic, baby.
What up?
Right. COVID-19 is a pandemic, baby. Seeking to ravage through your community's immunity. Don't get it twisted, this a viral act by the enemy. It's very deadly, even lost some close friends to me. I'm so discontent, I can't pretend to be happy what was going on with human beings. Plandemic, a pandemic, I hope that you deceased. I wish that you was in a chokehold, yelling I can't breathe. A hook to a ventilator without a remedy. This virus is real for those who don't believe. Taking life without your will like cop brutality. I heard the hospitals getting money for casualties. It's big business over bodies, that's reality. Wait, don't let them fool you. Behold the devil vaccine, they trying to use you. Airborne depopulation techniques. Ain't no empathy, the plan is to kill us both, you and me. And this ain't right, our Bill of Rights are in a frenzy. The people gotta fight to stay free, let's make it trendy. Right, COVID-19 is a pandemic, baby, ravaging our immunity. So stay protected, eat healthy, vitamin C and D. It's nothing simple, this a real complex disease. There's no control to track the old, young, strong, and weak. The plan is to keep us all up under siege, destroy humanity, kidnap society. And you see what it's doing to the economy. Right, COVID-19 is the pandemic, baby, ravaging our community. We gotta strive to stay alive, right now it's do or die. Cause COVID going wild, so wear a mask and sanitize. Cause these is wicked times, and COVID-19 has no conscience or no care time. So protect what's inside. Yeah. So protect what's inside. Protect what's yours, protect what's ours. G Mims, Plannedem-MIC, June 14th. Thank you. Thank you, Dr. Ford. Thank you for having me.
My man, G Mims.
Yes.
Loving it. Keep doing what you're doing, King. We appreciate you. And now we're going to kick it over. I believe Donna is coming back. And we got another live performance. It's time for healing. It's time for healing, ladies and gentlemen.
God bless. Thank you.
God bless you, brother. Please keep in mind, the information is scrolling right through the bottom of the screen. Please follow the movement. Please go to iTunes on Tuesday and make sure you get that song and put it in your playlist. All right. So as they get ready backstage, I just want to thank you all for just rocking with me tonight. My name is June Archer. I am a former recording artist turned music executive, author, motivational speaker, philanthropist, and television host. Please follow me on any platform at June Archer. That's JUNEARCHER. Or you could go right to IamJuneArcher.com and you see some of the things that I have going on. And please feel free to make sure you connect with me. Let's stay connected. We're all in this together. We're not out of this yet. And it seems as though as we're trying to get through COVID-19, they're trying to throw the monkeypox at us. But I do believe I see the narrative all over again. And we just have to take what we learned tonight and make sure that we put these things into practice, whether it's meditation, from Dr. Satyan, was anything from Dr. Nyo and Mallory and the biophysicists, everything that we learned tonight, please make sure you take that opportunity. This will be replaying again on Mass Consciousness. So if you didn't take notes, you'll be able to watch it again. And please tell someone you love them. Life is short and getting much shorter, but you never know when you may have the last opportunity to tell somebody you love them. So make sure you take advantage of it. So I believe they are ready to go. So ladies and gentlemen, I'm going to bring them back. Please welcome to the stream Donna and, of course, the rest of our ensemble. Take it away, Donna.
COVID-19 is the enemy, an invisible enemy we cannot see. Don't let viruses stop you from living free. Together we can break the chains of negativity. People all over the world are suffering from COVID-19. Don't you agree? Don't you agree? It's time for healing. It's time for healing. It's time for healing. It's time to rise. People everywhere across the land and sea, stand strong, don't give up. Please open up your hearts, give what you can, together as one. With the trust from above, we can overcome. If we put our faith in love, it's time for healing. It's time for healing. It's time for healing. It's time to rise. So please remember, we are all children from the Most High. Together there's no mountain we cannot climb. It's up to you and I. Time to rise. Time for God's light to shine. It's up to you and I. It's time for healing. It's time for healing. It's time for healing. It's time to rise. It's time for healing. It's time for healing. It's time for healing. It's time to rise.
Ladies and gentlemen, thank you so much for tuning in this evening. We appreciate you. We love you. And we hope you had a good time tonight. Donna, gentlemen, please give it up for Gregor Hubner, Feng Chern Hui, Ron Lawrence, and Jeremy Harmon. Thank you so much. You guys sounded amazing. Thank you so much for tuning in, everybody. Have a good night. And we're going to end with the video. So enjoy yourselves. Have a good night.
Look at that. Yes, doctor. You see it? The coronavirus.
Ah, part of the pandemic.
All part
Excellent.
of the pandemic.
Yes, doctor.
Watch your health.
Yes, doctor.
I've done it.
You've done it, doctor.
COVID-19 is a pandemic, baby. COVID-19 is a pandemic, baby. Seeking to ravage through your community's immunity. Don't get it twisted, this a viral act by the enemy. It's very deadly, even lost some close friends to me. I'm so discontent, I can't pretend to be happy with what's going on with human beings. Plandemic or pandemic, I hope that you deceased. I wish that you was in the chokehold, yelling I can't breathe. They hook you to a ventilator without a remedy. This virus is real for those who don't believe. Take your life without your will like cop brutality. I heard the hospital's getting money for casualties. Big business over bodies, that's reality. Don't let them fool ya. Behold the devil vaccine, they tryna use ya. Airborne depopulation techniques, ain't no empathy. The goal is to kill us both, you and me. And this ain't right, our Bill of Rights are in a frenzy. The people gotta fight to stay free, let's make it trendy. Right. COVID-19 is a pandemic, baby, ravaging our immunity. So stay protected, eat healthy, vitamin C and D. This ain't simple, it's a real complex disease. No control attacks the old, young, strong and weak. Focus is to keep us all up under siege. Kidnap humanity, destroy society. And you see what it's doing to the economy. Right, COVID-19 is a pandemic, baby, ravaging your immunity. We gotta strive to stay alive, right now it's do or die. Cause COVID going wild, so wear masks and sanitize. Cause these are wicked times. And COVID-19 has no conscience, so no care time. So protect what's inside.